Joining us now, Sean Connaughton. Sean, very interesting. He was the former Secretary of Transportation under the Bob McDonnell administration, now the president of the VHHA. Sean, great to have you with us.
Good morning, John. How are you? Happy New Year. And I can't wait to visit you in your new galactic headquarters up in Washington, D.C.
I know it's going to be a lot of fun, and it's good to have friends in high places. They invited me to do my show there when I'm in Washington, and I said, all right, so they've constructed me a studio, so we are fired up, and we're going to be there all weekend. Hey, lots going on in the Trump administration. There's never going to be a dull moment. I'm so excited. I think it's going to be transformational, right? So look.
Yes, I think so.
And I'm going to be bringing you all the action. Now, as my listeners know, the 2017 Virginia General Assembly session starts based on that special election. And I imagine VHHA and its members, hospitals, are going to be actively engaged in this process. What issues, Sean, as the president of the VHHA, what issues are you going to be most engaged in, and what is your overarching message to the General Assembly?
Well, John, I mean, our basic message is about doing no harm. Because if there's one thing that we're certain about is that there is an incredible degree of uncertainty out in both Washington and, as it all kind of flows downhill in Richmond as well. I mean, we are, on the cusp of seeing some dramatic changes to the Affordable Care Act, Obamacare. And, everyone focuses on the insurance requirements, Medicaid expansion, but also that law had a lot of provisions changing how we're reimbursed for our patients, delivery of service, all different types of requirements that, most people don't see and hear about, but has necessitated the hospital and healthcare sector to spend billions of dollars to try and comply with it. So we're encouraging the General Assembly to really do no harm. I mean, we're very concerned about what is going to happen with this repeal of the Affordable Care Act without a replacement plan in effect. We know this is all going to have some dramatic impacts in Virginia and across the country, and so we're spending a lot of time already up in Washington. I've been up there a couple times to meet with our senators and our delegation. I'll be spending several days this week up in Washington. And in addition, working with the General Assembly, I mean, we have some pretty big issues. Behavioral health, we put forward a package on behavioral health and opioids. Also, cybersecurity, we're supporting and put forward a bill on ransomware, which is something that's happening to hospitals across the country. We're working on issues on scope of practice and, actually providing greater flexibility to nurses to be able to provide services. And then we'll have our age-old favorite certificate of public need come back, which, we're very, very concerned about because, again, we just don't know what's going to happen in Washington and what impact it's going to have on healthcare in Virginia.
You know what, Sean, there is a great deal of uncertainty in D.C. right now. It seems pretty clear to me that changes are going to be made to Obamacare. I think it's going to be repealed and replaced at the same time, but it's going to be something's going to happen. What are the hospitals telling Congress about that, particularly when so many hospitals, especially in non-suburban areas, non-metro areas, are facing real financial stress, as you mentioned?
Yeah, in fact, right now, the latest statistics show about 43% of the rural hospitals, which is about half the hospitals in the state, are already operating at a negative operating margin. And, people don't realize that, almost two-thirds of the patients that hospitals and health systems see are Medicaid and Medicare and then pre-care. So it really isn't a free market out there when essentially two-thirds of your patients, two-thirds of your customers are paying, 90 cents on the dollar, 74 cents on the dollar, or zero on the dollar. So what we've been focusing on with our members of the delegation up in Washington is, listen, if you're going to go forward with this, we want to partner with you. We want to make sure we end up with legislation that deals with access, with the quality, and then with costs. We really encourage them to not cut any further their reimbursements. And I wanted to just make sure everyone understands. Talk about reimbursements. That is providing care at below the cost of providing that care. There's some cuts that were already scheduled for Medicare. There is cuts in the DISH program, which is part of Medicaid. We're encouraging them not to let those cuts go through until we deal with replacement. We're also want regulatory relief. John, in the last 9 months, the Obama administration has issued 20,000 pages of healthcare regulations.
Unbelievable.
It's incredible. And so if you're doing away with the funding for the law, which is what the focus of the reconciliation effort in Washington is, we still have this enormous regulatory burden that's out there, and we're encouraging our members to look at that and to try to provide some regulatory relief. And then, the other thing, we're just making everyone aware about this. It's been a long-term goal of the Republicans in Congress, and even in Richmond, it's been about trying to turn Medicaid into a block grant program. And we want people to understand what that potentially would mean to Virginia. Virginia has one of the most frugal and highest requirements to get Medicaid in the country. I think we're either 46 or 48, depending on how you count it, in the country for eligibility and for paying for Medicaid patients. Well, in states like Virginia, it's like $1,900 per patient per year. Mm-hmm. In places like New York, they're getting $5,000 to $6,000 per year. So if you just turn around and just do a blanket block grant, that will forever be sending Virginians' taxpayer dollars up to New York and other states versus trying to take care of people here in Virginia. So these are some of the messages, and then as this bill starts to formulate, we're going to be much more active in providing actual feedback on each one of the requirements. But given all this, I keep on coming back to Richmond. I mean, we have a lot of different bills that we're supporting to help make improvements to our current healthcare system. But some of these big issues, these economic, financial issues, we're just encouraging the General Assembly do no harm, because we know things are going to really hit the fan up in Washington, but we just don't know which fan it's going to hit.
Right. I mean, that's one of the issues, is you just never know exactly what's going to come down when the General Assembly convenes, so we'll be following that. Sean, you mentioned do no harm. That kind of sounds like a recurring theme, and I know several Republican leaders in the General Assembly have also said they prefer to see what occurs in Washington before initiating any major health care policy in Virginia. I got to tell you, that makes a lot of sense to me. Basically, the theme is look before you leap, right?
Yes, it is. And John, depending on, we know there's going to be major changes coming out of Washington. The General Assembly, if it all happens this year, I can guarantee you the General Assembly is going to have to deal with some pretty significant changes to health care programs in this state. And so let's just sit down and make sure we look at our health care policies across the board so that we deal with, providing access, better quality, and lowering the costs. And that's why we're saying do no harm. Let's all work together next year when we know there's going to be a need for a comprehensive reform to all the state's health care programs. And we're willing to work on it. We think there's opportunities to deal with access, quality, and cost. And we're trying to get that message across to our members of the General Assembly. And in fact, next week we're holding a lobby day, bringing in a lot of the hospital folks. We have several hundred who are already signed up to come in on next January 18th. We're going to be hosting a couple of these to make sure that the General Assembly hears that message. Well,
look, the whole thing is we don't know what's going to happen. There's uncertainty there. So let's wait and see what Washington does and then formulate a plan for that. I want to get back to Virginia for a minute. One of the issues that attracted a lot of attention in 2016 continues to be a topic of conversation is the so-called Certificate of Public Need, or the acronym COPN. Now, my listeners know my stance on COPN. I think repealing it is stupid. It's crazy. It doesn't make any sense. And it's a false narrative and a false equivalence saying to bring so-called free market competition into the healthcare marketplace is a good thing when we're not in a free market system in healthcare, because if you can't pay for anything or you don't have insurance, you just go to the emergency room. I mean, the whole thing is so ridiculous. And the narrative is upside down, which is what drives me crazy, because it's not even an honest dialogue. Now, it seems to me, and I get passionate about this issue, because repealing of COPN is a disaster for hospitals that are not in metropolitan or suburban areas, rural areas. We've already had one close in Virginia. We've already had 3 close in other parts of the Southeast, South Carolina and Georgia. Watering down COPN is going to weaken our system and our economy, destroy those hospitals in those areas. Because what happens, Sean, is medical companies come and they say, oh, now we're going to do free market. And they come in and they cherry pick only the most profitable services available, and they leave everything else of the hospital, which is in the rural area, already drained, and then they collapse financially, which wreaks havoc in the area. So I'm passionate. But watering down CPN doesn't make any sense at all. What's going to be your policy in trying to stop it? Because it's crazy.
Well, yeah, I mean, this is the thing. We're not quite sure right now. There's only been a couple of bills introduced regarding COPN. 2 of them actually have to do with behavioral health. One of them has to do with essentially how you count charity care requirements. I mean, but John, you hit it on the head. I mean, this is the problem for facing hospitals and health systems, who for the most part are not-for-profits, who end up providing care to whoever comes in that door, whether they're insured or whether they're getting Medicare or Medicaid. And as I mentioned, if you look at the users out there, 2/3 are Medicaid, Medicare, or indigent care. So when they talk about the free market, I mean, there is no free market in healthcare. I mean,
Exactly.
What ends up happening is we end up, having to provide the care to all these people, get reimbursed below cost, and then potentially other providers will come in, take the commercially insured, and leave the hospitals and health systems with the underinsured. And let me just point out to you, the last state to do away with COPN was Pennsylvania, and they had 48 hospitals close since then. 48 hospitals. And that is our concern, is because what will happen is all the commercial payers will be peeled off. And this is one of the reasons why the insurers are some of the people pushing this, because what they want to do is lower their costs and increase their profit margins. And again, we're trying to provide care. We think COPN is a good policy. We're only talking about very high-end types of services. And I'm sorry, if I'm getting open heart surgery or some of these other very high-end services, I mean, you're not dealing with issues you're not concerned about cost. You want quality.
Exactly.
And COPN is very important.
Look, you know what? And I don't want to get into this with you right now, because I'm very passionate about this issue, because it's what I call, and I'm a conservative, it's called Petri dish conservatism. Somebody comes up with this idea at the Heritage Foundation or something else, or the Cato Institute, then it gets funded by the companies that profit by it. But if you look at the whole picture, it's stupid, crazy, makes no sense. And I'm going to be fighting it in 2017, just like I fought it in 2016. Now, remember, VHHA held a public event last month to unveil its behavioral health agenda. I was there at your press conference. I know the governor and others are also pushing mental health reform. So that might be an opportunity for everybody to agree on, Sean, right?
Yes, it is. And, we listen, there's so many challenges in behavioral health, not only in Virginia, but across the country. I mean, we're just starting to scratch the surface in trying to address this problem. And, providing greater services, looking for opportunities. And again, though, providing for everyone. I mean, and this is one of our challenges, is when you look at things like behavioral health, there's one set of services for those who have insurance, and then there's another set of services for those who have Medicare, Medicaid, or indigent. And so, I mean, we need to look at everyone whether they're insured or not insured, in providing these types of services. And again, we want to work with the General Assembly and with other providers to help address this issue.
All right. Well, we look forward to that, and we know you guys play an important role in the health, the financial well-being of hospitals in Virginia and the medical community as a whole. Sean Connaughton, he is the president and CEO of the VHHA, the acronym for Virginia Hospital and Healthcare Association. Sean, anything else you want to share with our listeners?
Now, again, John, listen, I appreciate very much your comments. I mean, you get it. You know what we're facing, and it's really important right now, given that we have a new president, a new administration, new goals and objectives, like you were talking about before. I mean, we want America to succeed. We want Virginia to succeed, and so I mean we need to work together, and that's one of the reasons we're trying to get our message across. Next week, Lobby Day. Up in the Capitol, and then we're going to be holding another one at the end of the month. Just encourage your listeners to participate in the process.
Okay, Sean, so Lobby Day, January 18th in Richmond, right? Wednesday,
Yep,
January 18th.
and just go onto our website, I Support Virginia Hospitals.
All right, go to isupportvirginiahospitals.com. Now, Sean, you're going to have me up to do my show in your office one day, right?
We would love to, John. We always enjoy having you come and visit. And listen, I can't wait to come up to Washington, D.C. and see that beautiful new studio you have.
Yeah, we're fired up about that. But look, you got to keep fighting the COPN, because you know what? I get these people on the show and they're basically reading something off a script that got sent to them by the Heritage Foundation. I deal in reality, okay? And I've got a lot of listeners in rural Southwest and Southside Virginia that if these things ever went down there, hospitals would cease to exist, thousands of jobs lost, coupled with the fact that if you got to get to the hospital, do you want to go 20 minutes or 2 hours? Okay. I mean, this is just the reality of the world that we're in. So I'm very passionate about that and many of the other issues that you're battling there. Sean Connaughton.
And John, and just want to leave one thought. I mean, one of the things that's interesting about Virginia is that we're one of the few states with a very, very limited public health system.
Right.
There's only really the two state hospitals systems and then one municipal system, that's Chesapeake. And in getting to these points, this is why things like COPN are so important in Virginia, in that really all the other hospitals are their private sector. They need to be, financially have the financial wherewithal to continue providing services, and that's why also COPN is so important.
All right, we're out of time. I want to thank Sean Connaughton for being with us. Hey, go to Hospital Lobby Day. Get more information. Go to isupportvirginiahospitals.com. Great website. Yes. Hey, how easy is that? isupportvirginiahospitals.com. Remember, when you need the hospital, you want it to be there close by. isupportvirginiahospitals.com.